only 55% of young people would get vaccinated against COVID-19 if it was recommended to them. This is according to a new UNICEF South Africa poll. About 22% of the respondents stated that they'll not get the vaccine, and 23% are still unsure. The poll was conducted using UNICEF South Africa's free U-Report SMS platform and received more than 5,000 responses, with 75% of those from young people aged up to 24 years old. For more on this, we're now joined by Christine Muhigana, who's the UNICEF South Africa representative. Thanks so much indeed for joining us, and welcome to the program.
Thank you very much for having us, and good evening to you and your viewers.
All right, let's start with what motivated gathering this information.
So we actually thought about conducting this poll ahead of the date at which young people were going to be eligible, so that we have enough information on the perception of young people towards the vaccine, the COVID-19 vaccine, is to make sure that we have the right approach, the right communication, we go to the right places to make sure that the correct information gets the correct facts gets to young people as they go towards the vaccination sites. As you know, the eligibility date was moved forward somehow, and therefore we're coming out with this poll at the time when actually quite a good number of young people have been vaccinated. As of today, 1.3 million, which is very encouraging. They added to the momentum of the vaccine drive in the country, which is great.
Did you get a sense of their motivations for the reasons that they decided either to get vaccinated, not vaccinated? What were they telling you?
So a good number of young people are aware of the fact that the vaccine would protect them, would be good for their health. And therefore, that's why we believe that quite a good number of them went to the vaccination sites to get their jab. But as the poll is indicating, that's only 55% of them. If we go by those that we were able to reach, more than 5,000 that we were able to reach and who responded, and we feel that they are quite representative. So only 55% of them saying, they would get the jab if it's made available to them. But the good news there, or the sort of the balancing factor there, is that a larger number, so 86%, know that it would be good for them. We just need to be aware and overcome the concerns and worries that they have, which are related to the side effects of the vaccine. Quite a bit of myth and misinformation around, the effect it may have on fertility. So all of these things actually give us a good information of, what it is that we need to address. What kind of information that we need to bring to young people to counter some of these fears and concerns that are out there and are not necessarily grounded.
I suppose it's a difficult one in the sense that the demographics of those youth, the only thing they've got in common could be just their ages, because depending whether you're rural, urban, middle income, upper income, all of these issues and even levels of education perhaps play into this. How do you then go about messaging to a group as diverse as that?
I think the trick or the idea is to make sure that you are where young people are. The poll is telling us that young people trust television information they get on television and on radio. So not everybody would have a television at home, but radio is something that's quite widely accessible or available. So we need to make sure that we work with media, television, radio to get the right information out to young people. The next most trustworthy source of information, according to this poll, would be for the COVID-19 vaccine, of course, would be health workers. So we need to make sure that health workers who are in contact with young people know what their concerns are, and give them the information, empower them with the information that would allow not only themselves to protect themselves, but also to make sure that they get the word out to other young people, because we know how it is important for how important actually young people are messages towards their peers.
How does
the kind of campaigns we are, or the kinds of platforms that we are using in support of the efforts of the national and provincial departments actually take into account the various ways in which we can reach out to young people.
How do we compare South African youth with other parts of the world in terms of vaccination take-up, a desire to get involved or not?
As you know, in Africa, the access to vaccine is not what we would want it to be. So unfortunately, in many areas of the continent, what countries are doing, health departments are doing is still trying to make sure that they reach the most vulnerable, the elderly in the population. So there aren't that many countries where, in Africa at least, where young people have been given access to the vaccine. But in the industrial world, of course, they're eager, to get the vaccine, because, as you know, this pandemic has been quite hard on young people, restricting their movements, not allowing them to get together, to gather. So the vaccine is a way for young people, for like any other, actually categories of the population out there, to say, this is a way for us to get some normalcy back in our lives.
There's a lot of conspiracy theories and deliberate anti-vaccine campaigns out there. How are young people processing this? Are they a bit more, I don't know, astute in terms of sifting through some of this fake news, or how are they dealing with it?
Well, if this poll is an indication, they are more lucid and discriminating in terms of the information that's out there. The fact that that they're saying through this poll that the most trusted source of information would be media and television. Next to that would be health workers, and social media actually coming a little bit behind in terms of the percentage of young people who say that that's where they would go for a trusted source of information. It indicates that they have a good sense of where good and trustworthy and credible information would be. And what we need to do is make sure that we target those young people that we know would look for the vaccine, as a way to protect themselves, and give them through the right platforms and the right channels, the trustworthy, the credible, the factual information that science and the health sector is putting at our disposal.
Are you confident with the right communication, the right messages on the right platforms, that we will eventually end up with a high uptake?
Yes. And we are confident that we will get there. I mean, if we just look at what the poll is saying, we know it would be protective, the vaccine, but we're concerned about side effects. We're concerned about possible impact on fertility. So if that's what they're saying, and we give them, assurance that this is not the case, evidence and science says otherwise, or if there are side effects, this is how you can overcome them, and many have done so. We are confident that we will be able to get those at least who are hesitant, who believe in the fact that they could be protected through the vaccine, to take up the jab and help with the numbers that we need to drive up to get to herd immunity.
That's where we're going to have to leave it. Thank you so much indeed for joining us and sharing this illuminating survey results. And I'm hopeful that our young people will lead the way. Thank you so much indeed.
Thank you. Have a good night. Good
night. All right, so 55% of young people, if these vaccines are available to them, will take them, but they can be persuaded with the right communications to get that number even higher.